Facial characteristics are so unique to each individual, and today we're looking at a blepharoplasty case, aka eyelids. Now, everything in your eyelids is millimeters, which means meticulous detail when it comes to both looking at facial aging and surgery. My name is Dr. Julian De Silva. I'm a board-certified oculofacial plastic surgeon, and my practice is based in Harley Street, and I specialize in only facial procedures. Is this patient looking tired? Well, their tired appearance really correlates to their eyelids. Now, classically, family, friends, work colleagues say, are you tired? Are you stressed? Have you slept okay? Now, many of my patients have tried every lotion, every cream, every potion. Honestly, these do not work, as this is really anatomy that has changed in this area, and any skin creams can really only modify the skin, not the underlying anatomy. Now, this is a figure from my blepharoplasty book, and as you can see, this puffiness actually relates to the eyelid area, is actually anatomy, and this puffiness is orbital fat, and this orbital fat every single person has, and it acts as a cushion. It supports and it protects your eye. However, partly genetics, partly facial aging, it comes forward in the eyelids and gives rise to this puffiness. Now, the detail and artistry of blepharoplasty is reducing a small amount of this fat, but not all of it, because you need some fat for it to look natural. If too much is removed, it can result in hollowness. In this patient of mine, you can see this puffiness is in this area, and this fat is creeping forwards in the eyelid, and really this needs to be modified. But the second aspect is this ring, this dark ring under the eye, and this correlates to this bone, the orbital rim. Now, often blepharoplasty just means removing some fat and taking away some skin. However, to have a natural and longer lasting result, you really need to look at this bony rim and do something to improve this. Now, this ring, this dark circle, in my opinion, is so important to correct. My preference at the time of surgery is to add some natural fat. And it means taking a small amount of fat, usually around the belly button or your tummy, concentrating some of that fat in a machine, and then putting a small amount back into this area to reduce this depression. Now, the technique that is used is so important because everything is millimeters. The skin here is less than 0.5 millimeter thick. So all the instruments, the technique has to be really done with delicate precision. Too much removal, too much adding, well, you can see those results, but the fine detail can look really good. So in this patient of mine, I reduced some of the fat, I treated the orbital rim with fat transfer, and then I also used laser to tighten the skin and improve the skin quality with regenerative medicine. I do hope this has been interesting for you. If you have any further questions, please don't hesitate to let me know. Thank you for watching.